It feels to me like we always have more audits. The rules and the regulations are becoming longer and longer and longer and hundreds of pages. And keeping up with all of that is really challenging for therapists. And what we were seeing when we looked at some of the data is our clinicians were writing notes at times of the day when everybody should be sleeping. And that just was astonishing to us, that they are in no way able to take care of this in a 40-hour work week.
We didn't bring this to our staff with the idea of being able to, squeeze another patient in today because you can get your documentation done faster. It was, you can get your documentation done today and you can leave at the end of the day and feel like you've been able to wrap up your work. That is one of the reasons that we were really attracted to Eleos.
It also allows, agencies and leadership to feel more confident in their documentation, to be able to say, we're ready, we're audit ready, we are ready for any checks and balances, any oversight for our clinical documentation, because we're leveraging these applications and technology to be able to have quality documentation reflective of the services that were actually provided.
I think the unexpected outcomes are what we've been really surprised with. The fun ones are, when I first heard about this, I was gonna back out and there was no way I was ever gonna use this technology. And once I used it the first time, I thought, well, that's interesting. And now I can't imagine doing sessions without it. And I've heard people talk about, it makes me sound way smarter than I would have sounded if I was trying to type out a note quickly. It really catches the true essence of what I was wanting to accomplish in that session and spits it out in a way that is just really captures what I needed it to.
So we're already seeing just really positive results, and staff seem to be really excited about it. Even those who were a little skeptical at first are like, wow, why didn't we do this sooner?
The commitment to understanding what the providers in behavioral health do versus in other specialties of medicine and healthcare. And I think that really shows up in Eleos's commitment into the specific platforms that these provider groups use, like the EHRs and the telehealth, because it really shows that they understand what the workflow needs to look like in order to be in the behavioral health space.
I think one of the things that we really liked about Eleos is it's embedded in our electronic health record. You're not going out to another portal to use it, complete it out there, and then pull it back in. It's right there on the same page.
I think our staff and our leaders would say that we've received all of the training and support we would expect to receive, and then some, throughout the whole implementation process. So it's really been a fantastic partnership.
And you can tell that the company really cares about what they do and they want to be great. And those are exactly the kind of partners that I want to work with.